Welcome to Long-Term Care Policy and Management. This is Public Health 627. This is your Week 10 video. Your Week 10 video will be very brief. You have a couple other videos under your lecture tab, and so we're just going to basically go over internal and external controls of long-term care. So who controls long-term care? We've talked about this already in the semester. Facilities, as we know, are mostly private organizations. Some are publicly owned by cities, counties, or states, but it's certainly not the majority. Some are federally owned, like the Veteran Centers. Some are owned by nonprofit organizations, but again, certainly not the majority. Home care is also mostly made up of private for-profit organizations. So, external controls. What's an external control on long-term care? Well, long-term care is controlled externally by state and federal governments. But the federal government doesn't really directly control things like a nursing home. For one, they're not really allowed to, and two, it would be too tedious to try to use federal legislation to control the nitty-gritty. So what the federal government does is they control long-term care through rules that they tie to their federal dollars, Medicare and Medicaid. This is very similar to the way that the federal government controls hospitals. The state government usually controls long-term care much more directly, and they do this through license and regulation. License through facility licenses. So usually a facility, if they want to open for home care or a nursing home, has to get a license from the state. And the state will give a bunch of rules that goes along before you can get that license. Now there's also administrator licenses. So every long-term care facility needs an administrator, and the administrator has to be licensed. And so that's a way of also adding a layer of licensing and regulation to that process. But there is a whole host of other external controls on long-term care. Municipal or county controls, fire code or fire marshal codes. Individual nurses have to get licenses. So if you're a registered nurse, you usually have to have a license from a licensing board. There's building codes. Many cities and towns and states have public health departments. And all these other external entities can create another layer of regulation on long-term care. There's some other external controls that we probably won't get into, but we've kind of touched on them before, where it's like private accreditation processes. Think of like Angie's List, marketing and reviews, private reviewing entities, or sometimes corporate preferences. You don't really have to get deep into those. Now, what are internal controls? Now, internal controls are within the facility or the organization that controls long-term care. Usually, facilities are run by an administrator or an executive director. These are basically business people who run the organization. In addition, there's often clinical leadership who have control over the organization, such as the director of nursing. Often nursing homes will have a medical director that is a medical doctor who is kind of the internal end of the line for all things clinical. Now, a lot of corporations will also have boards that will give advice and feedback to the administrator. Nonprofits also have boards. So the internal controls on a lot of these facilities can also be complicated. So I want to keep it brief. That's it for week 10. If you have questions, feel free to post them on the discussion board or reach out to me privately if you want. Read the two chapters, and they will expand quite a bit on internal and external controls over long term care. Thanks, and have a great week.